I'd like to talk to you about the quite general concept of performing a painful procedure, such as venepuncture on a baby or a child. I've written there the tagline, it's not as hard as you might think, because I think that people tend to get very stressed by the prospect of causing pain to a child. Fair enough. We're all here today, to do our jobs, and we don't want to be causing any upset. But the reality is, very unfortunately, we rely on blood tests to help a lot of children find a diagnosis and get better. So I've invented what I call the 3 P's of painful paediatric procedures. The first P being preparation. This is so key. You want to be able to be sure before you even go anywhere near the child with a needle that the child himself and the caregiver are both prepared as to what's going to happen, that they're aware of what's going to happen and why it has to happen. You want to ask the permission to examine the child for veins and really think hard about pain relief and positioning. Where are we going to perform this task? Is it going to be in the same room that the child sleeps? I like to try and make sure that the baby or the child goes to a separate room for a painful procedure so that they can have a nice safe space where they sleep and a nasty painful place where they go for blood tests. We want to prepare the kit, the blood forms and dressings. We want to prepare any helpers that we're requiring and make sure there's enough equipment in the room of anything that we need, and prepare contingencies. You might have to bring extra needles just in case it's unsuccessful in the first attempt. You might have to bring the child's favourite teddy. You might have to bring an iPad. Just take a good amount of time to really think hard about what you're going to need. And if the child themselves or the young person is needle phobic or even very upset, this part here is definitely the most important, and it can take several hours. Sometimes children just sit there with their arms tucked away, completely refusing to let you even hold their hand. I like to use these 2 phrases quite repeatedly, to be honest. If it's easy, then you would get to be proud of yourself when it's all over. I usually say that and then let it hang out there for a second so that it does genuinely settle into the kid's head and they seem to respond nicely to it. And the one that I think they prefer is the boys and girls are loads worse at this than you. You can give examples of 15-year-olds, and I remember very well that as a young child you think of 15 as being a really old age and that those guys must know everything. So when you say that the 10-year-old, the 8-year-old is much braver than them, they tend to respond really nicely to that. The procedure itself. This is the part people are most stressed about, but really, it's a piece of piss. It's pretty easy. The veins are everywhere, as you can see some examples of in these pictures. Most commonly, obviously, we've got the back of the hands, the middle of the forearm, the antecubital fossa, or down there on the left you can see the picture of scalp veins, which is something we tend not to use, mostly because of our own conceptions and not wanting to have a needle near to the head. But the reality is there's very large excellent veins there which can be easily utilised. We'll usually use those after we've failed anywhere else. There are also veins obviously on feet, and we just need to make sure we take our time to choose the best option. A nice straight blue looking vein usually works fine. And the third, probably most important of all the 3 P's, is praise. Stickers, high fives, huge smiles. I tend to go a bit over the top here. Make sure I'm saying I'm sorry, I'm not doing this to hurt them, and that they've done really, really well. We're talking about how brave they are over and over again. The last thing I want for this child to do is to leave our ward or hospital or clinic feeling like they've done something wrong. They've undergone a painful procedure. They've done it very bravely. Even if they were absolutely awful, you have to tell them they were brave, so that if they come back again, that they're not absolutely terrified of us. And make sure you thank those helping you. This can be quite distressing sometimes for each of us, and certainly it's the first time you've seen it happening. It takes some time to get used to. Talking in more detail about the procedure itself, the equipment being prepared is something I'll just quickly detail in a separate video, but you can see here a selection of pretty much all different tools that you can use in order to get blood from a child. These ones are particularly common, and I'll just mention briefly the butterflies. Let me just turn on my tool here. Here, the orange butterfly is very, very small. It's the smallest one we have in a hospital. Blue, slightly larger than that. The thing you'd have to think about there is if you insert an orange needle, it's obviously smaller, but then the blood will come out, it's slower, and the child might be screaming throughout the entirety of the procedure. So a blue needle, if you've got a large enough vein, I find sometimes is kinder, as it makes the procedure take a lot less time, and can draw blood off the back or using a syringe, or you can attach one of these vacutainers onto the back of your butterfly in order to draw the blood into a bottle, an adult-sized blood bottle, and you can see that nicely demonstrated in another video showing my colleague Seth performing blood tests. The procedure itself should involve you obviously going to the patient, gaining your consent, checking the details of the patient that you've got the correct one. You want to position them where you've already planned to do so, identify the vein, apply the tourniquet, clean the area for 30 seconds, and then let it dry for 30 seconds. Apply pressure downstream, as you can see here with my colleague's left hand, pinning down the vein with his thumb, and then inserting the butterfly over the top with his thumb separate from the sterile area, which is here. Insert the butterfly, and then you should be able to remove the blood, like I say, piece of piss. Blood taking doesn't always look like this. Obviously this is a pretty large vein. What you do not want to do is be going at the vein from this angle. Maybe I'm starting off with an obvious point, apologies for that, because if you go in there, you're going to go straight through, and you can see that the tip of the arrow here is not in the vein, and the red spot there just shows that you've gone right through the vein, and you will not get any blood coming out the back of the needle here. If you enter into the vein, then you can turn, whilst just keeping the very tip of the needle under the skin, into the trajectory of the vein. And if you insert direct forwards at that point, then you will have some blood coming out the back of the vein, of the needle, just there like that. Here is a very artistic impression of an arm with a blue vein here. Apologies, this is a very awful drawing, but my point is trying to show you from a different direction. Needle going inwards, breaking the surface of the skin, not quite hitting the vein, nothing comes at the back. You will try and get further and you still won't get anything, so you have to give up. If you go in and go straight through the vein, then sometimes what you see just up here at the top is the small amount of blood, but it's not flowing. So you know you've been through the vein at some point and blood has come out the back, but you're now not getting free flow because the tip of the needle is not in the vein. So as you can draw back, and you pull back really slowly, you will hit that sweet spot when you're in the vein and the blood comes flowing out much, much quicker. So once you have completed your removal of blood, you want to make sure you take off the tourniquet before pulling out the needle. Place the cotton ball over the needle, remove the needle, and then apply your plaster. Move quickly onto the praise. Make sure your bloods are placed into their bottles. At the same time, you're telling the child how absolutely fantastic they are. Thanks very much for listening. I'm going to do another little video about gathering all of your equipment. You can also see Seth's performing venepuncture in my playlist.
I wanna watch it at the corner of the shore, where the waves are very peaceful in the sound of distant war. I wanna dive into its moment like a seal that swims beneath the storm. I wanna be inside its silence of a sound, where the memory of our future is just echoing around. I wanna feel it like a heartbeat beneath the crashing of the clouds.
Success.
I wanna dance with it across the empty hall, where the mystery of the through step is as secret as the fall that is always in the motion like a still and ever-flowing ball. I wanna go inside its place that never sleeps, not New York, but some high below the universe. universe that bleeps like the light out on a wing piece of a plane, seen by one so far below. I wanna slam it as the bell to bow begins, hold it down for a 3 count or just catch it on the chin. I wanna know it as it lies there in the blood and spit and say that's what I can. I wanna measure it in numbers like sand. I wanna calculate its distance in the outstretch of my hand. But when the sun is on the other side, it's sleeping behind paper doors in